Hello everyone, Miss Sambawa and I will be discussing the effect of duration of smartphone use on muscle fatigue and pain caused by forward head posture in adults. Working on computers and operating smartphones for a long period of time promote repetitive use of certain muscles, which results to muscle fiber injury, cumulative damage from acute trauma, and myogenic tonus, which occur most often in the neck and shoulders, especially nowadays that most people work from home and students have online classes, which leads to use gadgets for a long period of time. Fatigue and stress in the neck and shoulders occur more easily with the use of touchscreen computers than with desktops. Touchscreen computers include smartphones and tablet PCs. Using smartphones or tablet PCs cause people to lift down or slouch more than using desktops, because smartphones have small monitors that are typically held downwards, as you can see in the picture. Before we proceed, let us define what is forward head posture. Forward head posture, or FHP, is a specific musculoskeletal abnormality that is caused by a repetitive and cumulative trauma to the neck and shoulder. FHP weakens the deep cervical flexor muscle, the mid-thoracic rhomboid muscle for scapular retraction, and mid and lower trapezius muscles. It also shortens the pectoralis major and the neck extension muscles. FHP increases the muscle activity of the upper trapezius muscle. The aim of this study is to investigate the effect of the duration of smartphone use in adults with FHP and the onset of fatigue and pain in neck and shoulder muscle. And for the subjects and methods, 34 patients were examined in this study. Their average age, height, and weight is flashed in the screen. Also, these subjects excluded individuals with neck pain and those with congenital deformities, serious surgical or neurological diseases, limb injuries, or limb pain in the prior of 6 months. Galaxy S4 LTE-A smartphone was used in this study. The subjects were allowed to use messaging services, KakaoTalk, games, and also surf the internet. The picture shown is the goniometer, and it was used to quantify posture as they began to use a smartphone. The subjects sat comfortably on a stool with their feet on the floor, knee and hip joints at right angles, and trunk upright. Upper arms were raised to clavicle level to prevent lumbar overflexion. First, the electromyograms was performed initially for 1 minute and then for another minute immediately after phone use. Sampling rate at 2000 Hz and the bandwidth for EMG signal noise rejection was set at 20 to 450 Hz. The skin was exfoliated using sandpaper and cleaned with alcohol swabs to reduce the muscle resistance to the EMG signal. EMG electrodes were attached 1 to 2.5 cm apart in parallel with both cervical erector spinae and upper trapezius muscle fibers. EMG sensors were attached around both C4 areas for cervical erector spinae and slightly outward from the midline between C7 and the acromyoclavicular joint for the upper trapezius muscle. And pain was assessed using VAS. The picture shown is the Trigono wireless EMG system from Dalsys Incorporated that is used in this experiment. It is used to collect the surface EMG signal from the cervical erector spinae and the upper trapezius muscles. And for collecting and analyzing the digital signals, Dalsys EMG Works acquisition software for PC was used based on the digital signals that were wirelessly sent from the Trigono base station. Fast Fourier transform and spectrum analysis was used to interpret the data from each muscle before and after experiment. The median frequency was used as an index for muscle fatigue. SPSS version 22.0 using the paired t-test was used to analyze the muscle fatigue, changes in FHP, and severity of pain before and after the experiment in the 3 groups. One-way analysis of variance, or ANOVA, was used to compare the muscle fatigue, change in FHP, and pain by elapsed phone use time. Least significant difference was used for post hoc test, and the level of significance is at 0.05.
Results and discussion. In a group 2, there was a significant difference in the muscle fatigue before 72.73 plus minus 12.19 and after 70.08 plus minus 11.24. The experiment in the left upper trapezoid muscle P less 0.5 in a group 3, the significant difference was observed in the left cervical erector spinae before 68.61 plus minus 6.59 after 61.93 plus minus 6.98 P less 0.05. There were other significant differences in the comparisons before and after the experiment. 71.62 plus minus 8.73 and 62.90 plus minus 7.07 in the left upper trapezoid muscles and 75.44 plus minus 6.30 and 66.17 plus minus 8.26 in the right upper trapezoid muscle, P less 0.05 in this table 1. So LCE is, as you can see, LCES is left cervical erector spinae, RCES is a right cervical erector spinae, and LUT left upper trapezoid, and RUT right upper trapezoid. So in table 2, there was a significant difference in the muscle fatigue in the left upper trapezoid between group 1, 75.12 plus minus 9.60 and group 3, 62.90 plus minus 7.07. So all visual analog skill scores before and after the experiment increased, with significance show for all the 3 groups. Smartphones are used frequently in daily life and affect users both physically and psychologically. According to EOM, a survey of adults over age 20 revealed that 18.8% had experienced symptoms related to musculoskeletal disorder from smartphone use, and that pain had increased with duration of use. So, in previous studies, revealed that smartphone overuse places the head in unvarying posture, and that continuous muscle contraction and also brings about muscle weakness and fatigue that could easily develop into chronic cervical pain. Muscle fatigue is caused by work and that require repeated movement in static posture. In this study, male and female participants were enrolled and allowed them to use the phone freely for web surfing and messaging. The subjects held the phone in their left hands and used their right hands frequently, which lead to greater load on the shoulder that perform the same motion. conclusion, pain and fatigue worsen with longer smartphone use. This study provided data on the proper duration of smartphone use. Correct posture and breaks of at least 20 minutes are recommended when using smartphones. However, these studies have limitations, and additional studies are needed regarding cumulative trauma, posture, changes in the neck and shoulders, and treatment methods for related disorders.